If you're worried about getting up on your own, patients should push the call bell and ask the nurse for help. Sitting up in a chair will make you feel like you have more energy, you'll feel less dizzy and less weak.
General myth around recovery is that if you stay in bed, the more rest you get, the quicker you get better. That is actually not true. From my experience, even though the first steps are the most difficult ones to take, they're the most important ones, because the earlier you start mobilizing the patients, the earlier they can get out of hospitals. Family members might say, oh, mom and dad needs to stay in bed to get rest. What I see is they can actually develop hospital-acquired complications. It takes them longer to recover because they now become medically declined. We always encourage you to get up for meals, get up to go to the bathroom, get up to do what you normally would do at home. If you want to take a walk, go get the paper. It is really important that you continue to do that because it is key to your recovery and key to your discharge.
1/3 of our patients who come into the hospital develop a new disability because they're not moving. Therefore, this threatens their ability to return home and return to their prior functioning. So it's very important that we focus on early mobilization. That means within 24 hours of admission to the hospital, and daily mobilization. This doesn't need to be walking around the hallways 10 times a day. It simply means getting up for all the meals, getting up to walk to the bathroom, getting up to walk to the nurse's station. All these little bits of activity help to ensure successful transition to home.
So the challenge that we're trying to tackle is how can we optimize mobilization of older patients who come into hospital, because we know that the rate of mobilization for older people is unacceptably low. So as soon as we admit patients to hospital, what do? We put them to bed. And one of the challenges is that on average, once patients are admitted to hospital, they're upright only about 30 minutes a day. When people are immobile in hospital, in particular older people, for every day that they spend in bed, they probably lose about 1 to 5% of their muscle strength. So they lose their ability to participate in self-care, to walk, to be able to be independent in the community. And so there's good evidence to suggest that if we mobilize these